BC's new health minister was in Terrace today for the name-giving ceremony of the new hospital. But before the ceremony, MLA Josie Osborne stepped into our CFTK-TV studio for a chat about healthcare in the North. Here's CFTK-TV's Jaylene Matthews with the interview.
So thank you so much for joining me, Minister Osborne. I know this is a relatively new appointment. How has your first couple months as health minister gone?
Well, it's been about 3.5 weeks, in fact, and it's incredible. I am so honored to receive this appointment, and there are a lot of challenges that we're facing, and British Columbians made it really clear to us throughout the election that they expect us to do everything we can to strengthen our public health care and mental health care system, and I'm really looking forward to digging in, and this is my first trip as health minister, so I'm really proud that I've come north and here in some of the more remote parts of British Columbia.
And it's a fun thing, you get to open the new hospital too.
It is. I mean, it's a real honor. I'm obviously building on the incredible work of Minister Adrian Dix before me and everything that people here have done. I know people have been waiting a long time for a new hospital here, and to see that it's doubled in size, that it's going to be able to serve the entire region. I've been hearing stories already from people up north about how much this hospital means.
Absolutely, and I know one of the biggest issues that have been plaguing our region is ER closures and staffing shortages. How is that being addressed?
Well, it is tough, and it's hard on families and people, and we need to have confidence in the healthcare system, in the hospital, and knowing that the emergency room is open. I come from a small town myself, and just imagining having our ER closed is a really difficult thing to do. So it's tough because we are experiencing a global shortage of healthcare workers. But the good news is that we are doing a lot to bring in new doctors, new nurses, healthcare workers into all parts of British Columbia. I'm very determined to tackle this issue around emergency room closures, particularly in rural British Columbia. Coming from rural BC myself, I think that I'll be able to bring a really valuable lens there. But just continuing to do that work, we are really excelling there, but we've got more to do because we want to make sure that healthcare is there for people when they need it and when they need it.
For sure, and I know one of the big barriers, often nurses and doctors, it's costs a lot to go to medical school. Is that one of the things that are being addressed?
Well, you're right. There are costs to that, and there are costs to moving into rural areas, and so providing incentives. So we have incentives for locums to visit rural areas and work there, for nurses and other healthcare workers to do that. That's a really important part of it. Opening British Columbia's first new medical school in 50 years, specifically around family practitioners and building the cadre of family practitioners that we have here in British Columbia. That's all part of it. Expanding the medical school at UBC. It's an exciting and really fulfilling career for people I know, and we're going to continue to do everything that we can to support people who choose that career path.